biggest questions we get is how are the diets going to change after surgery? Are people going to be able to eat what they quote unquote say normal food? And the overall answer is absolutely yes. I mean, one of the biggest concerns is that people can go back to eating actually very bad foods after something like a sleeve, bypass, duodenal switch and be absolutely fine. Now, there is an issue that people ask us a lot about, and that's dumping. Dumping is something that you would really see only after something like a gastric bypass or a duodenal switch. So what is dumping? Dumping specifically is where somebody has something where they kind of know they shouldn't have. Maybe not just a cupcake, but it's a cupcake with frosting on it. And a lot of times it has to deal with some of these high fructose corn syrups that are in our foods. Sometimes it's simple carbs like white pastas or white breads causing this problem. But ultimately what happens with dumping is somebody eats this and it causes a massive insulin surge, which messes with their glucose and they feel very sick from it. They feel very sick from it for about 20 to 30 minutes usually, and then that passes, and then they're fine. Now, after something like a gastric bypass, probably only about 15% of patients will have significant dumping issues. 85% won't. And the reality is most people have modified their diet where it is not problematic for them at all. And so I don't see dumping as usually being prohibitive. Some people actually see it as a positive thing because they're not, it's kind of a governor on them eating bad foods. Our hope is, after these surgeries, a sleeve, bypass, duodenal switch, your cravings and your desires and your wants for bad foods drastically changes. And the goal is to build a healthier habit. And so it's not like a diet where you're saying, well, I don't want these things because I know they're bad for me. You just don't want those things because they're not appealing to you anymore. And we build off of that. And when we build off of that, issues such as dumping, issues such as eating the right foods, moving more towards a healthy plant-based diet, it's much easier to do. Thank you very much.